indicate glucose tolerance test. So our body, how they are going to tolerance of that glucose molecules. So we are going to test that tolerance of the body. Those glucose where we are giving orally. Right? So that is called glucose tolerance test. Here, if we'll talk about the indications, so those patient which have symptoms that suggest the diabetes mellitus, but not the confirm, eh? Only the suggestive diabetes. So what happened? Fasting blood sugar value is inconclusive. That means the value is in between 100 to 126 mg per deciliter if there is in between that fasting blood glucose. And the person is suggestive for the diabetic, but not the confirmed. So those patients, they have to undergo for the oral glucose tolerance test. And during the pregnancy, the individual having excessive weight gaining, if we are noticed, if clinician noticed, the gynecologist noticed the weight gaining process is too much high, or the past history is big baby, more than 4 kg of baby born, or past history is miscarriage, then they also have to go for the oral glucose tolerance test. Or to rule out benign acute renal glycosuria, if in early stage, if there is a glucose impaired tolerance, if there is a glucose is there in the urine, for the confirmation also we are going to do oral glucose tolerance test. So what are the contraindications? So contraindications means those person, they do not need to go for the oral glucose tolerance test. That means the person is already confirmed diabetic, already declared diabetic. They do not need to go for the glucose tolerance test. And GTT has no rule in follow of diabetes. Once confirmed by doing this test, no need to follow up for this test. So it is the only initial test for the confirmation purpose only. Once confirmed, the full step is there. No need to go for again the test. So it is indicated only for the initial diagnosis. So this test is not going to do for the prognosis purpose. So this test is only going to do for the diagnosis purpose. And the test should not be done in acutely ill patient. So patient is suffering for something else. If there is infection or other things. So no need to do this test. Otherwise, you will not get a proper result. Coming to the preparation phase. So how will you prepare the patient? The person should have been talking carbohydrate-rich diet, taking carbohydrate-rich diet for at least 3 days prior to the test. If you are giving the the date of the test after 3 days, so you have to advise the person having they have to take rich carbohydrate diet in their regular dietary pattern. And the drugs, those drugs which is going to alter carbohydrate metabolism should be discontinued for at least 2 days. But in the case the person is taking any essential drugs, so they have to take permission from the clinician. Then only they can discontinue. Otherwise, no need to discontinue. The subject should avoid strenuous exercise on the previous day of the test. If you are going to do the test by tomorrow, so before a day of the test, we have to avoid the strenuous exercise and gym, all these things. Otherwise, they are not going to give you proper results. They should be in an overnight fasting state. That means if the individual have taken a dinner at 8 p.m., so the ideal time for the test is day after tomorrow. That means 7 a.m. or 8 a.m., in between the 7 and 8 a.m. That means the duration will be 10 to 12 hours fasting. That is called overnight fasting. During the course of GTT, the person should be comfortably seated and should not refrain from smoking and exercise, because this is time consuming test. So once we started the test, during that period of the test, so patients should be seated comfortably. So they have to avoid the smoking and exercise. Otherwise, it may alter the glucose value. So coming to the procedure. First, GTT should be conducted preferably in the morning. So morning time is the best. So fasting blood sample is drawn and urine collected in the fasting state. So once patient visited hospital, laboratory, so make sure the patient having overnight fasting and collect the sample, blood sample as well as urine sample, and the mark that sample as a 0-hour sample. Okay, am I clear? Am I right? Okay, so that sample is 0-hour sample. And once you collected 0-hour sample, you can go for the glucose load. The subject is given 75 gram of glucose orally, dissolved in about 300 ml of water, to be drawn in about 5 minutes. That means in 300 ml of water, 75 gram of glucose is going to dissolve, and they have to drink within the 5 minutes of that glucose. When the test is done in children, if you are going to perform the test in children or lean individuals, the glucose dose should be adjusted. That means 1.75 gram of glucose per kg body weight we have to take. According to the body weight, we have to calculate and we have to give that much amount of glucose to that children or lean patient. And coming to the sample collection, first sample is 0-hour sample. Then second sample, blood and urine should be collected at 30 minutes interval. Once you give in glucose load to the patient, so every 30 minutes till 2 hours, we have to take sample, blood sample and glucose, blood sample and urine sample. That means after glucose load, half an hour sample, then 1 hour sample, then 1.5 hour sample, then 2 hour sample. That means 4 sample, and one is 0 sample, 0-hour sample. That means total sample is 5 number of sample we have to collect. Okay, so all blood samples are subjected to glucose estimation, while urine samples are qualitatively tested for glucose. As you all know that urinal threshold of blood glucose is 180 mg per deciliter. That means once the blood glucose exceed 180, you will get glucose in urine. That's what in diabetes individuals, you are getting urine in, you are getting sugar in urine. That's what. If it is below 180, you will not get the sugar in urine. So that is that. No, 180 is the renal threshold of blood glucose. That's what we are going to measure the urine, estimate the glucose in urine. So this is the message. So how will you interpret once you analyze the 5 simple blood sample, whether the individual is suffering from diabetes or not, if you are something else? So how could you confirm? So we have to draw the graph. Suppose 0 hour simple, you got value around 80, 82, 85. Okay. Half an hour simple, you just got a value around, you can call it, this is about 110, one below 120, 126, below 126. 1 hour simple, just you got a decreased value around, it is a 110. 1.5 hour simple, you got, after glucose load, that is around 105, 110. And 2 hours after glucose load, you're getting around 100. So that means this value shows the normal one. And the graph, you can see here, after glucose load, there is increased and then decreased, and simultaneously is going to be decreased within the narrow range. So this, if you'll get a graph like that, that means the person is normal. Suppose another person, you got the graph like this one. So 0 hour value is around 126. Half an hour once glucose load given, afterwards we are getting around 170, 180, and slightly there is a decrease, otherwise almost same. 1 hour simple, then 1.5 hour and 2 hours, we are getting here around 150. So this is not going to give you a clear cut picture. It is neither normal nor increased that much. So in between that, so you can call it as a impaired glucose tolerance. Something alteration is there, but not the confirmatory diabetes. So it is called as a impaired glucose tolerance. So another one, if you're getting uh, that fasting, another patient, if you're getting fasting is almost around 130, 135, it is, that means more than 126 mg per deciliter. The fasting simple, 0 hour simple. And half an hour simple, just see here, it exceed the renal threshold. It is more than 180. Almost more than, it is 200. Around it is 240. And 1 hour simple, slightly decreased, that is around 230. 1.5 hour, it is around 220. And 2 hours, it is around 210. That means it is more than 180 or 200. If the blood glucose is in postprandial conditions, if you are getting more than 200 in a one occasion, or fasting blood glucose is more than a 126 mg per deciliter, so it confirms that the individual is suffering from diabetes mellitus. So that is the confirmatory. So this is the confirmatory graph for the diabetes mellitus, and this one is impaired glucose tolerance, and this one is the normal. So this test shows that the normal individual is able to tolerate that glucose which had given orally to the individuals. But in impaired glucose tolerance, the individual is somewhat they are going to able to tolerate, but not exactly. And this is the diabetes. The person is the tolerance capacity is almost affected. So it confirms the person is suffering with the diabetes mellitus. So that is the confirmation. By doing the oral glucose tolerance test, we can confine. So once confined, there is no need to further do the glucose tolerance test. So this is the test for the only confirmation, but not for the prognosis. And this is the elaborated form. And this is the renal glucose tolerance. And one more than one, so 180 is the renal glucose tolerance. And this is the when the value is much more, that is the severe uncontrolled diabetes mellitus. This is the moderate. So diagnostic criteria by the WHO, the fasting blood glucose should be more than 126 mg per deciliter, as I already told you. In one occasion means in graph, just see here, if it is one occasion more than 126 fasting, that is confirmed. Or if 2 hours postprandial glucose load value more than 200 mg, even one occasion. Just see here, this is the more than 200, 200, 200. If it is one, at least one is more than 200. We can also confirm that the person is suffering with the diabetes. So that means postprandial after glucose load, at least one occasion is more than 200. And the fasting one occasion is more than 126 mg per deciliter. That confirms the person is suffering with diabetes mellitus. So if both fasting 2 hours value above the level on same occasion, if the random plasma glucose level is more than 200 mg per deciliter or more than one occasion, so that confirms the diabetes. So diagnosis should not be based on a single random test alone. It should be repeated. So if it is you are getting high, then you can advise the individuals after a few days, after a week, again they have to visit and you can test. So by single random test, you can confirm. So it should be repeated. So this is the WHO standard of that conformity criteria for the diabetes mellitus. So you have to keep in your mind, if the fasting blood glucose is more than 126 mg per deciliter or postprandial is more than 200 mg per deciliter, so that confirms the individual is suffering with the diabetes mellitus.
सर त्यो
So
पछाडिको के अरे कर्ममा चाहिँ त्यो ग्राफमा चाहिँ के त्यो रेनल ग्लाइकोसिरिया के भन्न खोजेछ यहाँ?
that means the kidney is unable to filter that glucose. So they are going to leave it. Once the blood glucose is more than 180 mg, so blood glucose exceed more than 180 mg, so nephron they are unable to filter out. So that glucose is going to excrete out through the urine. That's what according to the 1 plus sugar in urine, 2 plus, 3 plus, 4 plus. So that indicates and that confirms the severity of diabetes mellitus. So if the blood glucose is more than 450, more than 500, more than 350, so we'll get 3 plus, we'll get 4 plus, like that. And one thing, so it is nowadays we are not going to do that much oral glucose tolerance. Why? Because they have lots of drawback. The patient should it will take around almost 3 hours of time. They have to stay in the hospital. So nowadays WHO advised that fasting blood sugar or postprandial blood sugar, if we are going to measure, that means fasting means 10 to 12 hours of fasting blood sugar, and after exact 2 hours of lunch, that means food we are consuming, exact 2 hours, not a more than that and not a below 2 hours, exact 2 hours after food, and regular food, not those food you are taking every day. So that food we have to prefer. Regular diet should be taken. Then only we get the confirmed results. So exact 2 hours, that is called postprandial. So WHO recommended that fasting and postprandial is also called as a modern glucose tolerance test. So there is no need to take the sample in half an hour, 1 hour, and 1.5 hour, 2 hours. It is quite painful and it will time consuming. So they advise, WHO advised that. So modern glucose tolerance means fasting blood sugar and postprandial blood sugar. So that is called modern blood glucose. So modern glucose tolerance test. I think it is clear. So gist of the day, we are going to confirm the diabetes. We are not going to, once the individual confirmed, so we are not going to do the again the test. So it is the initial confirmatory test, and it is only going to used for the diagnosis of diabetes mellitus, but not the prognosis of diabetes mellitus. As I already told you that for the prognosis, there is a guidelines for the that test according to, as I already discussed in lab diagnosis in diabetes mellitus. So that test is going to do for the prognosis whether the condition is, you know, quite progress or bad progress. By doing that test, as I already told you, so we have to prefer that test. And so this is all for today. Within a few seconds, we are going to disconnect. So if
Sir,
you have any
sir,
query, you can text me.